Good afternoon, everyone. Welcome to the November 16th Texas Balance of State COC General Meeting. This is Cameron Fowler, Continuum of Care Director at the Texas Homeless Network. We hope everyone can hear us okay. If you can't, please type in. And just want to remind you all, you can type into the chat box and or raise your hand, and there will be points during our meeting that we will unmute you all if you would like to join the conversation. For now, we're going to keep you all muted to reduce background noise. And want to go ahead and have the staff in the room and joining us remotely just say hello and introduce themselves, and then we'll show you all a map of everyone that's joining us today, and we'll get started.
Hi, this is Caitlin Bear, and I'm the Balance of State Programs Coordinator.
Hi, this is Jesus de Leon Serratos. I'm the HMIS Program Manager.
Hey everybody, I'm Craig Blaze-Piero. I'm the COC Programs Assistant.
Hi, this is Lindsay Marsh, and I'm the Data Coordinator.
This is Sophia Cheka, and I'm the Systems Change Coordinator.
Mary, are you with us?
Hi, this is Mary Ricklick, and I'm the COC Manager.
Well, Mary is with us. She's joining us from Paris today. She's actually out traveling. So we'll be hearing from her later, and hopefully her sound will work. If y'all take a look, we've thrown up the map of attendees today and have multiple folks from these places on the map, and see a really good representation from across the state in our service areas. Just want to thank you all for attending, and as always, we hope to see more dots on this map as we have more meetings throughout the year. I do want to go ahead and let y'all know we're starting for our meetings over the next year to do a spotlight on communities and or local homeless coalitions. And if you have a program, a project, or something that you would like us to feature, please feel free to email Mary, our COC Programs Manager, at mary@thn.org. And today we have joining us Sergeant Eric Quijada. He's with the Lubbock Police Department's Homeless Outreach Team. Some of you may have had an opportunity to see him present with some of his colleagues at our annual conference this year, and we're really excited he's agreed to share with us a little bit about the HOT team in Lubbock and the work that they are doing with those individuals and families experiencing homelessness in Lubbock. So Eric and Sergeant Quijada, can you hear us?
Yes, I can. Can you guys hear me?
Sergeant, you still with us?
Yes, can you hear me?
If y'all give us a minute, these are the joys of distance meetings.
Am I coming through? Can you guys hear me?
If you can hear Mary, she can't hear.
Mute us.
Oh, it looks like
Sergeant, you with us? I can't hear you.
Looks like some people can hear me.
Ah, yay!
Can you hear me now?
Gotcha.
We can hear you now.
Okay, very good. Well, I appreciate you giving me the opportunity to do this. This is something I never thought I'd ever be doing, especially as a police officer. Police, we don't usually do social work, and so this is new for us. We don't have any kind of training or anything like that, and that's kind of what we're doing here, but I love it. I'll tell you a little bit how we got started. Back in December of 2015, an officer, or Corporal Stephen Bergen, proposed the idea of having a community outreach project that included work with people who happen to be homeless. And he brought it to the chief, and the chief said, well, I like that idea and we need to do it, but maybe in 6 to 7, maybe even 8 months down the road. Well, little did we know, at the same time, our city council was bringing a problem to our chief, our new chief at the time, said, hey, we have a lot of people living on the streets here downtown Lubbock that's bothering the business owners and everybody downtown. They're being bothered by this, but we want to help these people. We don't want to make laws against it and just shoo them from one place to another. And so the chief proposed Stephen Bergen's idea, and lo and behold, 2 months later we were created, and he said, go out there and help people. We had no clue what we were doing at all, and there's no training, but we knew we needed to be out there and help people. So a little bit what we do is we rely on the community, because without the community we can't do any of this. At first, we're funded now by the City of Lubbock Police Department, but at first we had no funding to do anything. And so we got donations, and we worked with different organizations, faith-based organizations, Chamber of Commerce, and they were able to give us money and resources to go out there. And all we do is we're a referral, basically. We do support services, such as we help housing, shelter, food and clothing. We help with medical care. When I say we help with medical care, is we don't give them medical attention. We make them appointments. We try to keep them away from the ER or emergency room as much as possible, because that costs, the taxpayers a lot of money for maybe just a stuffy nose. So we reach out to our local community health care clinics, and we try to get them appointments there and signed up there for long-term treatments. We help a lot with mental health. A lot of the misconceptions among, I know, police is that we can't do things like emergency detentions unless they want to hurt themselves or they want to hurt someone else, which is not the case. And we're trying to get to the fact that, unfortunately, mental health amongst the homeless community is very high, and sometimes they can't afford to get the help they need just by that, the resources that's out there. So sometimes when someone's a danger to themselves due to mental decompensation, we're able to get them that help when before we couldn't. And we've gotten a lot of people the help they needed and the medication they needed to start getting back on track and improving their life. We also help with addiction services. There's several places out there that, take addiction, whether it be for alcohol or narcotics, whatever the case may be, and get them into inpatient or outpatient help, whatever's best for that person. And when you're on the streets, you just don't know what resources they can, and they're a little intimidating that these places can be. So we'll actually bring these people to these appointments, and we'll sit there with them until they feel comfortable enough to do it on their own. We help with employment. We'll refer them to, here in Lubbock we have Texas Workforce Solutions and places like that. We'll go help them fill out resumes and get them job references and help them get jobs. We're still learning how to get people's Social Securities and IDs back. We refer to a local church here that has been able to help along with that process to get their cards. It's pretty puzzling to get that stuff back sometimes, but we're working with them to do that. But our biggest thing that we do is we build a rapport. We're trying to bridge the gap between police and the homeless community, because before, when a business owner or a resident had a problem with someone that may be homeless, they called the police. Well, most of the time they're not committing a crime, and it's not a crime to be homeless in Texas, and that's where a lot of people are they get confused. They think, well, I'm going to call the police because this guy's homeless and walking in my neighborhood and I don't want him in my neighborhood. Well, that's not right. And so that's where we're kind of bridging the gap. Before, the police would approach these people and they would run, or they'd become very combative or argumentative right away. And we've gained a rapport with these people now that they trust us and they're starting to ask us for help, and we're able to get them that help. And we're starting to change the mentality, the way police and homeless interact with each other. One of our biggest programs we have is our bus program. My big deal is with my team, we're not going to send someone to be homeless from Lubbock, Texas, to somewhere else, either in Texas or anywhere in the United States, to be homeless. It's not right. So we have a few guidelines we like to follow. One, they can't have any warrants, because that's the federal law, that's outlawry. We can't just send someone away that has warrants. So we'll try to take care of their warrants if we can. If they have any open cases in Lubbock, we try to get those resolved, and we have to make contact either in person, over the internet, or by phone, and talk to a family member or a person that says, yes, I will take, Jim Bob in, and he can live with me until he gets back on his feet. And so at that point, once we have all that lined up, we will buy a bus ticket on Greyhound and send them to where they need to go. And as of right now, since February, we have sent 21 people, either reunited with family, or we've gotten them housed here in Lubbock. So, and I know a lot of chiefs around in big cities or even small rural communities, they say, I'd love to do that, and there is a problem in my community, but we don't have the resources or the money to do that. And I can tell you from experience, if you can get 2 guys, even 3 guys, you don't need the money. You just need to donate your time, those officers' time, take them off patrol or whatever you need to do, and the community is willing and wants to help the homeless population, and the community will provide, big or small. It's a great tool. You don't need a lot of money to do it. And I think the more this word gets out around Texas, I think the more law enforcement's going to get on board and help with this.
Wow, thank you so much. I gotta say, you all are doing more than any other police outreach team that we have heard about, and it's so crucial, especially in these smaller communities, especially when there isn't, a project or program that's doing outreach. And it really does sound like you all have changed, the landscape on how law enforcement works with this population and how this population is responding to you all. And thank you for addressing the funding, because we know that's always a concern. And to hear, that has worked in a city like Lubbock, we know that other cities can do it. What kind of other advice would you give another community that is looking into starting a police outreach team?
I think the best advice would be just to do research, and I'd be more than willing to, I'll type it in the message bar here after I'm done, but I'll provide our information and they can contact us. But do your research with other agencies that have a homeless outreach program, and they can send you numbers that proves that it's helping the cities. It's saving all the bottom line. The city cares about money.
Right.
That's what will go around. And so if you show a city and a mayor, whatever the case may be, a sheriff, a chief, that you can save them money and this is how you do it, they'd be foolish not to get started. So, but research is the big thing. Research and numbers, and if you can provide that to your city leaders, and then get it out to the public will make them do what they need to do. Mm-hmm. That's just bottom line. It sounds harsh, but that's just how it is. Yeah. So awareness, I guess, is the best referral.
So I know from the South Plains Homeless Coalition Facebook page that you guys visited the Kansas City outreach team. How instrumental was that in how you designed your program?
It was very key. We went to Wichita, Kansas. They've been established since 2011. Their city is almost identical to ours. It's just a slight bit bigger. So it was the perfect I guess, training grounds for us. But like I said, there's no training in this. So we reached out to, Houston PD, Colorado Springs, Colorado, Kansas, and Wichita, Kansas was the first to get back to us, and they said, yeah, come along and we'll show you what we do for a week. And it was very instrumental because there was laws, the ACLU, and there's things that maybe our city was doing or thought about doing that wasn't so legal.
Mm-hmm.
It wasn't, just wasn't right. It just morally wasn't right, maybe. And so that was the biggest thing we took back from there, is that, you can't just treat these people like garbage or just like a rodent that you need to get rid of because they're human beings.
Mm.
And that's how a lot of cities are handling it. I think that was the biggest thing we did. It was very instrumental in what we did and how we changed when we got back. And I think every city that's going to start that needs to go somewhere, whether they come to us or any of the, like Colorado Springs been established for quite a while. That's very important to do.
Well, thank you so much, Sergeant Quijada. It's hearing straight from you all how you've done this, and we've heard, like Sophia mentioned, from the coalition there, and Chad Wheeler about the work you all are doing, and we're hoping to head that way soon, and hopefully we'll get a chance to meet with you in person. But just want to thank you again for taking the time to share and for doing what you do. I'm certain you will be getting some emails with your offer, and we appreciate the work that you're doing. Thank you so much.
Thank you. I appreciate the time.
All right. So I guess Sergeant Quijada will put his information in the chat bar, and we can also provide that to you all when we send out materials from the meeting. And now, assuming we can hear Mary, who is joining us from actually doing some travel in the balance of state right now. She's in Paris, is going to go over some COC governance with you all. Mary.
Hi, everyone. Can you hear me?
Yes, ma'am.
Great. Well, yes, I am in the lovely city of Paris, very far in North Texas. Met with a couple of groups in their community this morning, and I'll be walking you through a big part of what we have already talked about this morning in terms of we thought it would be great to, since this is our first meeting of our new year for the COC general meeting, we wanted to give a little bit of orientation since we have a lot of new folks joining us today. Certainly a lot of people have been added to our email list and are registered for the meeting. So we thought we'd catch you up on what is PHN, what is the Texas Balance of State COC, and what are local homeless coalitions, and how are we all working together. So Craig, I think you and I had talked about, I will just tell you which slides to advance, but I don't see my slides yet on the screen. There we go. All right, so we'll start with what is Texas Homeless Network. We are, next slide please, a statewide nonprofit. We were incorporated in 1991 as a part of the Texas Interagency Council for the Homeless meeting its legislatively mandated activities. So state departments that have been working together as the Texas Interagency Council for the Homeless, or TID, needed some help doing what they are required to do by the legislature, and so they helped to fund Texas Homeless Network to do some of that work. Our mission is to provide solutions to end homelessness in Texas communities, and we get funding in part from the Texas Department of Housing and Community Affairs, the Department of State Health Services, and on the federal level, the U.S. Department of Housing and Urban Development, or HUD, COC program. And you'll see there at the top, we are celebrating 25 years of existence this year. And our campaign is called Impact 25. And some of our focuses over the years have changed. Most recent iterations that we're working in new and different ways, like rapid rehousing, permanent supportive housing, to really put an end to homelessness. So we're making much more progress in that arena. Okay, next slide. Texas Homeless Network is what's called the lead agency for the Texas Balance of State COC, and that means we coordinate all kinds of planning and carrying out the activities that are required as continuums of care around the country We, of course, rely very heavily on our local homeless coalitions to help us carry out all of that work, but we are the spearheader of it, and so things like staying abreast of best practices, helping communities understand how to implement those in their communities, how to collect the data, how to make sense of the data, how to use it to make strategic decisions. All of that is how we can be your thought partners in our work. And we do cover a very large portion of the state. If you go to the next slide, you'll see we are the lead agency for all of the counties that are in orange on this map. That is the balance of state continuum of care. There are a number of other continuums of care in the state. You'll see they're all designated by color block here. Some are smaller, like one county wide, El Paso County, Dare County, and Travis County. Amarillo is the smallest up there in the Panhandle. They are a citywide coalition. We've got Wichita Falls and Green. They are the largest coalition in Texas besides South. Fort Worth, or Tarrant County, COC is in purple. Dallas is in yellow. Waco area is in gray. Brazos Valley is in maroon. Houston area is in turquoise. So those are the other COCs, and everyone else falls into the Texas balance of state COCs, of which, again, Texas Homeless Network is the lead agency. So we're your go-to people for all things related to homelessness. Next slide, please. Okay, so what is a continuum of care? That's one of the questions we get most frequently. It's a little bit confusing because it can mean several different things. But the COC program interim rule, which is HUD guidance, says that a COC is a group organized to carry out the responsibilities required under the COC program for a defined geographic area. So the continuum of care you'll see in the boxes here, it can be the people, the community-based planning network, the geographic area, and a HUD program. So if you're confused by what is a COC, it's not a surprise because it means several different things. In our particular case, we like to focus mostly on the fact that we're a group of people all working together to strategically and effectively prevent and end homelessness in our geographic area. Okay, next slide. The purpose of HUD COC program, there are four. One of them is to promote a community-wide commitment to ending homelessness. So we want to help people understand that everyone has a role to play. Every person, every industry, every issue area. It's not only homeless services that need to be involved in ending homelessness communities. The COC program also provides funding for us to do our work. We want to help people effectively use mainstream resources that they might be eligible for, and that can help them increase their income or their employment, or in some other way help them get into a better position of basically not needing us anymore. And that's the fourth one, ultimately optimizing their self-sufficiency. So even if projects in our communities don't receive HUD COC program funding, this is the planning model and the service delivery model and the evaluation and data use model that we apply across the entire field. So you don't have to receive COC program funding in order to join in this work. Next slide, please. Okay, so in order for all of us as a country, and HUD specifically, to achieve the goals of the COC program, they've assigned the responsibility to COCs, like Texas Balance State COCs. And there needs to be a clear lead entity accountable for reaching the goals. So that's how we at Education and the Local Homeless Coalition and the broader COC all work together to help achieve the same goal as the federal government has for preventing and ending homelessness. So we've got our assignment. Next slide, please. So some of those COC responsibilities are the same kind of things we talked about. Establishing a COC, which ours was established in 2006, and a COC board. The most recent board members were elected at our September COC general meeting. We also administer and operate the Homeless Management Information System, or HMIS, and that's a client database. And we like to have all projects that are doing homeless and housing services in our communities to participate in the HMIS. As the more complete data that we have, the more accurately we can make decisions and know what's working so that we keep doing more of that to prevent men's homelessness and not continue to do things that maybe aren't quite as effective. We also conduct all kinds of COC planning and operations activities, like one that's coming up soon is point in time count and housing inventory count. We're implementing coordinated entry, and we help facilitate the application for funds, specifically for the COC program. That's a big part of our work every year is running that COC level competition for those HUD funds. Next slide. How do we know when we're being successful? Well, HUD has some performance measures that they are requiring all COCs to report on, and we will be working with all of our projects and our communities to be looking at the data as well for length of time that persons remain homeless. We want to make that as short as possible, of course. The extent to which persons who exit homelessness to permanent housing return to homelessness. We want to try to help people stay out of homelessness after they've been in it. Number 3 is the overall number of homeless persons at any one time, which really goes closer to number 5, the number of persons who become homeless for the first time. So what can we do to help people not ever fall into homelessness in the first place? Number 4 is helping people increase their employment and income. So again, that they're more able to be self-sufficient and not need homeless services in the future. And then number 7 is how many people are we getting into permanent housing through our homeless services. That's a huge measure of our success. Number 6 doesn't really apply to us right now. It's regarding people who are homeless under another federal definition besides HUD. But we're not quite there yet. We're still focusing on all the people that meet HUD's definition of homelessness. Okay, so COC governance, we can go through this part pretty quickly. We do have a governance charter as a COC, and it lays out the authority and decision-making roles and accountability and responsibility for all of the entities that are an official part of the governance structure. Just want to point out that the governance charter does include our COC policies and procedures. So those board-approved policies that we are following as a COC and how we're carrying those out. So next slide shows you the governance structure. As the lead group, we've got our COC general membership, and that really is a very broad group of anyone who's in the COC who is working to address homelessness is considered to be a member of the COC. Now we've got our COC board. Again, they were elected at our September meeting, and their terms will be for 2 years. Actually, some for 1 year while we're in this transition year to get staggered terms. Local homeless coalitions are a really incredibly important part of our governance structure because that allows us as a COC to be active in local communities because our COC staff at CHN aren't in your community every day, but the local homeless coalitions are. And then CHN plays the role of those next boxes as COC lead and HMIS lead. And then we have an option for COC committees, which we'll be hearing about probably at next month's meeting. Okay, next slide, please. Again, just some of the COC policies and procedures that might be important for you to know about. We've got written standards on how to administer permanent supportive housing and rapid rehousing. Those are drafted, and they will be going out for public comment sometime soon. And it's just exactly what it says, some minimum written standards that we want all the projects across the DOT to follow. So we definitely need everyone on setting some realistic standards. There's a memorandum of understanding for the COC lead agency that helps CHN know what we need to do as your COC lead agency and make sure that we're getting it done. HMIS data quality and security, protecting the privacy of that information, keeping it safe, making sure it's as complete and accurate as possible. Performance evaluation, so that we know whether our services are being effective or not. And then finally, required reporting, not only to HUD, but to our COC board, to the Homeless Network board, and to LA. Next slide, please. Okay, COC board. Again, it's the primary decision-making body for the COC. They determine the policy direction, ensure that we fulfill our responsibilities, and basically oversee all the work of the COC. Next slide. We increased the size of our board in September, or before September, but for this fiscal year from 11 to 15, so that we could get some broader representation. So you'll see we do now have 15 seats. One of them is still vacant, seat number 12, Law Enforcement Criminal Justice. We didn't get any nominations. Oh, in fact, we got one yesterday, I think. That was our first one. So if you know someone who might be interested in that seat, let us know. But we do now have one nominee. So it's cool. But all the others are in fact filled. They were nominated or elected in September. Next slide. Board members must comply with the Code of Conduct and Conflict of Interest statement. They'll have broad representation. We'll have no more than 50% of members who are affiliated with the Continuum Care Program or Identity Program funded project. Again, just to make sure we've got some diversity. And the board will include at least 5 local homeless coalition chairs. And we do in fact have 5 chairs among the board members. So that's a great connection. Local homeless coalitions. Those are the groups on the community level who work together to plan, deliver, and evaluate services. And you also have broad membership. You're aligning your local goals with our COC goals, but also tailoring it to your community needs. And your chairperson serves as a liaison to the COC. So let's look at the map on the next page and we'll see where we have active coalitions currently. All of the colored groupings of counties are their own coalition. So we've got quite a few, I think about 25 around the COC now, but you'll see all of the communities in gray are covered by a different coalition. But the white communities don't have a coalition yet. So if you're in one of those communities, you would like to talk with us about developing this coalition, we'll be happy to talk with you about that. And for those of you who are out there and active and working with us, we really appreciate it because we need you out in the field doing what you're doing. Next slide, please. There is some LHC guidance that our COC board has developed that we hope you adhere to. They're on our website, but in short, it's that you're meeting quarterly, you're doing some strategic planning for homeless services, you're looking at data and performance, you're going to conduct a point-in-time count in your community and a housing inventory count, and that you will implement coordinated entry when we give you the tools to do that. Next slide. Some of our priority projects as a COC are, again, applying for HUD COC program funding. We walk you through that process. Next slide. That's just some materials that are on our website related to the COC process, because it has to be very transparent. Next slide. A big part of our data is, again, the Homeless Management Information System, or HMIS. You can contact our HMIS team at any time, hmis@chn.org, to ask more about it or to get technical assistance. Another big data piece is on that next slide, the point in time count that we will be having on January 26th, and the housing inventory count that goes along with it. If you have questions about that, or you aren't participating yet but would like to, please contact our data coordinator, Lindsay at chn.org. Next. Again, those system performance measures I talked about earlier. Next slide. Coordinated entry is another big project we have. Cynthia is our systems case specialist, and she's the person that you will talk to about coordinated entry in your community. And she'll be talking a little bit later in the meeting, so I'll let her fill you in. Next slide. We also work with consolidated plan jurisdictions, those groups around the state that receive funding for community development block grant, home fund, emergency solutions grant, and or HOPWA, housing opportunities for persons with AIDS, and ending veteran homelessness has been a big focus over the past year with our SSDF and HUD-GAS programs. And we even as a COC adopted the definition of ending veteran homelessness. And with all of our work, we're following the goals of the federal strategic plan to end homelessness, called the Opening Shelter. Next. Oh, the last two slides are just pictures of us on staff. And when you see these slides, you can look at this more closely. But we try to just give a face to all of our names, because so many of us work with you just remotely via phone or email. So we're going to give you a picture of ourselves, and you can know who you're talking to. And that's it. If you have any questions about who we are, just let me know.
Thank you, Mary.
Thanks, Mary. We are going to move right on into a COC current priority project, and Caitlin is going to talk with us about some COC program grantee updates and info.
Hi y'all, this is Caitlin. I'm the Balance of State Programs Coordinator, and you have probably heard from me somewhat recently if you are a grantee of the COC program, because it is getting time to submit APRs for some of you. As many of you know, after the end of your grant year, you have 90 days to submit your APR to HUD in eSnaps. We're also asking that we get a copy of that PDF export from eSnaps. So because eSnaps was closed for a couple of months in the middle of this year, we have a bunch of them due at the end of this month on November 30th. You should have been contacted by me if you're one of those people. If you haven't yet gotten an email from me about needing to turn in your APR, you will about 90 days after your program ends. So look out for an email from me. I'm going to be helping you guys to make sure your data quality looks good and that your eSnap submission to HUD is just as it should be. I also wanted to remind those of you who have been contacted about project improvement plans, or performance improvement plans. Those are coming out soon. I know we told you a long time ago that they were coming soon, but this time for real they are coming soon. We're working on a policy and procedure that we can give you, so that way the performance improvement plan is very transparent, that you'll know exactly what your expectations are, and that the process will go very smoothly and with a lot of accountability. So we want to make sure that that's laid out for you before we start talking about that. So that's been the holdup, but it will be there soon. We also wanted to remind those of you who are COC program grantees, or for those of you who are currently receiving ESG or who are interested in applying for ESG in the future, attendance at these meetings are really, really important, because this is one of the ways that we measure what we call COC engagement. So how much do you participate in the planning of the COC, how much do you participate in being educated about the COC. So your attendance is something that is, for our COC programs, it's mandatory. And for our ESG programs, it will impact attachment either A or B. It kind of depends on what TDHCA decides to call it every year, but we all know that attachment that the COC has to fill out to help you apply for ESG. It will affect that, so make sure that someone from your agency signs in every meeting, every month that we have, so that way we can track your attendance and make sure that you're getting full points for COC engagement. That's a good point, Craig. So we have some persnickety software here, and if you only call into the meetings on the phone and you don't also log in with the web application, you're invisible and we can't see you, and your attendance isn't going to count because we can't prove you were there. So it's kind of like going to a meeting where you forgot to sign in on the sign-in sheet. We don't have a record that you're there, and while it might be true that you were there, we can't count it. So make sure that whenever you want to get credit for this, that you are signed into the web application. And that's not to say that you can't use your phone for audio. You just also need to be logged into the web application. So whether you use audio through your computer speakers and mic, or through your audio, or through your phone speakers and mic, make sure that that pane is open somewhere on a computer. Otherwise, we cannot see you, and we can't give you credit for it. Very last thing, because I promise I'll keep this short, is we want to make sure that all of our COC program grantees have had a chance to read our policies and procedures, which were released a couple of months ago. We're going to be sending out via email a little form for all of our COC program grantees to sign, just to certify that you've read it, you've understood it, you've had a chance to talk to us about any of your concerns about it, and that you will abide by them. So make sure you get a chance to review that before you sign it, so that way what you sign is true. And if you do have any questions about it, you are welcome to reach out to THN staff. I'd recommend reaching out to Mary, because she's really, really great with policies and procedures stuff. Her email is mary, M-A-R-Y, @thn.org. You're also welcome to reach out to me, and my email address is Caitlin, which is spelled C-A-I-T-L-I-N, @thn.org. Not just .org.
What's your email?
Long day. Caitlin@thn.org. And that's about it for me. Oh, sorry, I lied. One more thing. We have some resources on our website that I wanted to point out to you. Craig, can you pull the website up real fast? And if it's not fast, then I'll just email it to you. All right. So on our website, we have a number of really helpful materials for you to read that will help you stay in compliance with some of the things you're going to see in the COC policies and procedures. So if you go under the Balance of State menu and then scroll down to COC resources and click on it, then you can go to Texas Balance of State COC grant materials, and you click on that and you scroll down and keep scrolling. Did it tell you which bar? I may have. Okay, sorry, slightly up. All right, stop right there. You're going to see THN Housing First Resource List, about 3 up from the bottom of that section, and then underneath it, THN recommended resources regarding project conversion and reallocation. I know not all of you converted or had to reallocate, but in those documents you'll see a lot of great resources about best practices for PSH projects, best practices for rapid rehousing projects, how to implement housing first, all these kinds of things that we're trying to focus on for the COC program in the future and during this year. So go ahead and give those a read when you have a chance. I know it's super interesting stuff, and you guys have so much free time to just, peruse resources. But even if you can just review one resource a week or one resource during lunch, you're going to be way ahead of the curve. So those are just places where you can find this. And now I'm done for real. Oh, and Craig just put the links in the bar, so that way you can find them very easily. That's it for me.
Great, thanks, Caitlin. Sophia, coordinated entry.
Hey, everybody. So I spent the end of last month, early this month, frantically writing our coordinated entry written standards and toolkit. As of Monday of last week, the public comment period opened. So written standards are effectively standards by which all the local coordinated entry systems must adhere to. So I really encourage you guys to peruse them. They're critical for COC program and ESG program funded agencies. You guys are statutorily mandated to participate, therefore I encourage you to check them out. Public comment ends at midnight essentially on Friday, so get them in. I've only gotten 3 comments thus far, so we need your input. And then in the middle of next month, early next month, I'll be sending out the finalized written standards, the final toolkit, and ideally the HMIS workflow will also be complete. So everything will be going out, wrapped in a nice bow, just in time for Christmas. You're welcome. And what was I going to say? The toolkit is a guide for how to analyze your current system and how to develop the new system. So it is guiding you through all things systems change. So I encourage you guys to read the written standards and the toolkits together, because the written standards are the guidelines by which your coordinated entry system needs to adhere to, and then your toolkit is how you're going to create your coordinated entry system. Yeah, I think that's the gist.
I put the link to the written standards in the chat bar, so if anybody needs the last few resources we've talked about, they have instant access to them right there.
Thank you, Craig.
Thanks, Sophia. And now Lindsay is going to talk to us about the pit counts.
Hi everyone, this is Lindsay, and just to remind you, the point in time count is on Thursday, January 26th of 2017. I actually don't know who's on here, so I would assume that a lot of people who are on the call right now are going to be participating in the count, or you are possibly on your point in time committee or a point in time lead, so thank you. For those of you who aren't, please contact me, and I would love to put you in touch with someone in your community who's participating in the point in time count, and if no one is, then it's not too late to start planning, and it'll be a lot of fun. It's really important to get these numbers so we don't have to estimate the number of people who are homeless on a given night in your community. It's a really difficult task to do because we just don't know your community like you do, and having multipliers that might be a little out of date is never fun. So please, please, please participate in the point in time count. On that topic, there have been some discussions about the youth count this year, so I want to let everyone know what is happening. HUD has announced that the 2017 point in time count is going to be the baseline when they're measuring progress in ending youth homelessness in the context of the point in time count. So what does this mean? Well, it means that HUD measures national progress for ending youth homelessness. It's going to use the 2017 count as the initial comparison year. So it's critical that your communities make an effort to find and count unaccompanied youth who meet the point in time definition of homelessness. And lots of communities have relationships with their McKinney-Vento liaisons, and you should turn to them to help identify the unaccompanied youth. And it's always beneficial for communities to know the homeless population within their students who attend ISD. But for point in time purposes, and I know this is a huge bummer, but we cannot count doubled up students. They do not meet the point in time definition of homelessness. However, I would really encourage you, it is a really good idea to present this data to your local community and your local stakeholders, and because these people are homeless in your community, they just don't meet the point in time definition of homelessness. And it's fine for you to say, you know, officially we have this number of students who are homeless, but we also have this number of students who meet the McKinney-Vento definition of homelessness. So, you don't have to always present the number of youth that we give you for the point in time count. Always look and give that caveat of, well, here are the number of students who meet the McKinney-Vento definition. And it's obviously always going to be higher. So, but HUD is using 2017 as the baseline. Does that mean that your local community has to use 2017 as the baseline? No, it doesn't. If you had a really good youth count last year, then you can use that. But nationally, 2017 will be the baseline for measuring ending youth homelessness. And that's all I have right now for the point in time count.
Thanks, Lindsay. Yeah, I just want to kind of echo what Lindsay said. If your community is not participating, we would love to see you start. This data is really important in continuing funding and getting additional funding. And if you're not participating, we're using a formula, and we're already using a snapshot from the PIT. So we, if you're in a community that's not doing a PIT, please get in touch with us, and we would love to help you start that this year. Also, just so everyone is aware, with the new youth initiative, HUD is working closely with educators and on how to align some of the definitions with McKinney-Vento and to get a more accurate youth count. So that's definitely stuff that is being worked on in DC and elsewhere. And now we're going to talk about the AHAR with Jesus. What's the AHAR, Jesus?
The AHAR. We're good on acronyms here. For people that has a short-term memory like myself, I need to be reminded that the AHAR stands for Annual Homeless Assessment Report. And it is the report that we sent to the U.S. Congress, the COC count, on the extent and nature of homelessness in the United States, or in this case, just our COC. It provides count of people experiencing homelessness and describe their demographic characteristics and service use patterns. The AHAR is a bit complicated because it is not a standalone report. In order for it to be effective, it has to play well with, Nancy was talking about point in time, it has to play well with point in time, it has to play well with the housing inventory, and it deals a lot with all data that you have in your HMIS. So, we're talking that this is a time of the year where all your work, all your data is actually put to some real use. Not that it doesn't work on a daily basis, but this is actually the data that help fund projects, change policies. This is data that shapes the story of homelessness in our COC. And just to reinforce knowledge, it is just aggregated data. We're not talking here about any personal identifiable information. It's just the data that accounts for any person who spent at least one night in an emergency shelter, a transitional housing program, or a permanent supportive housing project during during 1 year. It usually goes from October to September. In this case, it's from October 2015 till September 2016. And there's different shells, different categories that we submit throughout the year. We have, for example, emergency shelter for families and individuals. We have transitional housing for families and individuals, permanent supportive housing also for families and individuals. And then we have to multiply that for all of the veteran programs. So we send a set also ES-FAM for veterans, ES individual for veterans. You get the idea. Also, there is a summary reporting category that captures information on people who use multiple programs during the reporting period. And this is where it gets a little complicated and we need a little more of your assistance because this information, as we said before, it can be used to inform the public and help policymakers craft appropriate intervention strategies to prevent and end homelessness in our COC. Also, not everybody participates, even though, you already heard the categories. Some project beds are excluded from this coverage calculation. We don't count, for example, safe havens, or VASH beds, veteran affairs, supportive housing beds are not counted either. Any beds are in HMIS, obviously we're not going to count those. Street outreach projects, rapid rehousing projects, homelessness prevention projects, those are not counted either for our calculations. The same with supportive services only projects. We're talking here about housing projects that are not rapid rehousing, emergency shelters, and permanent supportive housing. So what do we do? Why do we need your help here? Well, obviously it's your data. It's all of our data now. But we do need to produce a non-duplicated list. And that sounds very easy, but it is not easy. And I will tell you why in a minute. We need also to identify overlap across program types. Know if a client went from an emergency shelter and then that client went to a transitional or a permanent supportive housing. We need to be able to identify those clients. And having duplicate data doesn't help us. It complicates a little the process. And that's what I mean about duplicating or having a good unduplicated list. We have to count people also by housing types. What do I mean by housing types? Well, you know, there's different compositions depending on what family is counted in HMIS. We have like individual adults, for example. We have adults in families with children. We have children in families with adults, household with only adults. So, I mean, as you know, there's different definition. It becomes a little more complicated. It becomes quite an ordeal when we have missing date of birth, for example, because then the system gets confused. It cannot identify whether you are in a household with children or not because there's no date of birth, so we cannot do that differentiation. We also have to generate counts of people with certain demographic characteristics and previous housing situation. What do I mean? I mean ethnicity, race, gender, age ranges, veteran status, disability status, household type, household size, and previous living situation. This is why we insist on sending you emails and asking you for extra information. Having lots of missing data doesn't help our cause. Our data is deemed unusable, and then it is very sad when that happens. We have to count also the total number of households with children by reporting category. Also, we have to generate a total length of stay for each person's by reporting category and cross-tabulate the data by gender and age. Yet another ordeal, especially with emergency shelters. See, we insist on you putting people in beds once you finish the enrollment process, because if a client is not in a bed, that bed shows that it's not being used, and therefore our utilization rates will be abysmal. Well, not truly abysmal, but I just like using this word. Abysmal. I mean, it is bad anyways, but we are. It has picked though. It has. It is showing progress, but it's still not enough to make that part usable yet. So why am I saying all this? Well, we might send you more information. We need a little more of your help. In order to submit the best AHAR that this COC has ever seen, and keep in mind that last year we raised the bar, but this year, or actually last year, we fell short with transitional housing, and still we were able to submit a very good AHAR. But this year, I think we're gonna put those transitional housing in. So I'm really excited about that. But a lot of it has to do with what you guys are doing too. So even though each year our data is looking better and better, we do need to keep doing that, and we will continue to ask you for your assistance. But yeah, we do need to do some extra cleaning, and we don't have a lot of time, so we will ask for your collaboration. You'll notice that we haven't sent any data quality reports yet, and this was done on purpose, even though Cameron doesn't like it. I did it on purpose since this is a priority right now. Right now, I'm just concentrating on AHAR. I didn't want to overwhelm you guys with multiple emails and correcting a bunch of different set of data. So to avoid confusion, I'll put that on hold just until we finish this report, and then after that, you're going to receive a lot more. But yeah, since this is a priority, we're going to just focus all our attention on having this completed. I do still have a few cases with missing names, for example, and actually that complicates also the unduplicated count. We have some missing date of birth, more duplicates, families that are not enrolled together, so the data doesn't match, and we have 2 weeks to complete it. So it's doable. That's my motto. It's doable, but But I mean, I'm counting on you guys for a lot of this. Sometimes I feel like I'm in a very bad episode of Black Mirror, but I think that we will be able to submit this and have a very, very, very good AHAR. If you have any questions, you know where to find me. My email is Jesus, JESUS, @thn.org. But even if you don't get in contact with us, we will get in contact with you. Thank you. Thank you very much.
Thanks, Jesus. Yeah, y'all, I think y'all heard this consistently from us in the past year, and we'll continue to, that we know the work you all are doing is with people, and they're the most important thing about this, but what drives the funding and the continued funding is the data, and also should be driving your program design, and we need it to be complete and accurate, and we want to work with you all to get that done in the best way possible. So if your staff is in need of training, please let us know. If you have staff that have been on the system, for a while, things have changed and they need updated training, please let us know. We also really want to encourage managers and program directors to get trained in the system and be able to run reports to see how your staff is doing with entering data, and strongly encourage our HMIS admins at every organization we work with, regardless of funding, because you all impact our COC funding, and we also believe there's really nothing more valuable than data in this work to get us more resources so you all can continue the work you do in the field. So please know that you're going to be receiving emails from us about it, and we are going to continue to raise the bar, and we want to work with you all on that. So moving on, and Mary mentioned this earlier, we are moving, and Lindsay's going to share about system-wide performance measures, and she's going to be sharing our first, what we've been calling SMPs, another acronym for you all. Our first report that we submitted to HUD, and this was based on, well, Lindsay will tell you the amount of time, but so this is our baseline for HUD on these performance measures, because we didn't have this report 2 years ago, so we weren't really tracking this information. We're really excited about this report. We think the data is going to be really valuable.
Hi. Okay, so this is Lindsay again, and I'm going to go over the 6 measures, the 6 system performance measures, and after I'm done, I'm not going to get too deep into it, but after I'm done, then Cameron's going to talk to you about how this really does impact our COC. The first one, and I hope everyone can see, again, despite my fairly new lens prescription, I still can't see this.
I got you.
But so we'll look at measure 1. Measure 1 is length of time persons remain homeless, and this is the most critical sign that our homeless, or your really in ours homeless service system is working efficiently. This measure shows us how quickly people who are experiencing homelessness are able to move into permanent housing. So we break it up into we run it 2 different ways. The first way is we run for people in emergency shelter and safe haven, but we don't have any safe havens in the balance of state, so we only run it for people in emergency shelter. So you'll see the universe, that means the total number of people, and then you will see an average length of time homeless, and then you're going to see a median length of time homeless. And so then we run it for people in emergency shelter, again, we don't have safe haven, and transitional housing. So it shows you the universe, then it shows our length of time homeless average, and then we have a median length of time homeless. And obviously, what we want to see going from year to year or even quarter to quarter is this number going down. Now these are the numbers that we submitted to HUD, and this covers the time from October 1st, 2014 to September 30th, 2015. Okay, so we'll move to measure 2. And measure 2 is looking at returns to homelessness. So the people here, they had exited to a permanent housing destination, and then we look at the returns to homelessness. And we break it up into people who returned in less than 6 months, people who returned 6 to 12 months, and returns 13 to 24 months, and then number of returns within 2 years. And
can you explain what the median is versus the average time? That's a question for me.
yes, your average is taking all of the time or all of the days homeless and picking out the number that is in the middle. I'm sorry? Okay, yes, I'm sorry. The median is taking out, looking at all of the days the person was homeless and picking out that number that's in the middle. So that's your median. And your average is looking at all of the days that a person, do you want to go back? Okay. And so your average length of time homeless, you'll see for, let's do the bottom one there, 72. So we're taking all of the days homeless, adding that up, and then dividing it by that number that we had. So it's your average and median. It's kind of like going, I'm trying to think of just basic math where you would have, I don't even...
Well, so if you have... Like,
I'm not good with basic math, which might be a problem with this. I'm trying to think of shapes. We used to use shapes, like cutout shapes in school to do that. Caitlin, I think, is going to look up an official definition. That might be a little easier.
Oh, no, I was trying to come up with a good simple analogy. Then I realized that for my simple analogy, the median and the mean were actually the same. So that didn't help. But so for instance, if you have a series of numbers, let's say you have numbers in a line, you have 1, 2, 3, 4, and 5. Your median is going to be whatever number appears in the middle. So if we start at 1 on one end and 5 on the other end, and we had to walk it in, then you end up at 3. Because that's the number that's exactly in the middle of that list. So that's your median. It's the exact middle number. Your mean is if you add 1 plus 2 plus 3 plus 4 plus 5, and then you divide it by 5. It ends up being the same number in this example, but if you had like a series of numbers that was like 1, 20, 37, and 50,
yes,
then the mean and the median would not be the same. I just can't do that in my head.
And mean means average. It's the same thing. So this is actually kind of interesting. If you're listening to news reports and people are talking about the average household income and the median household income, you really need to pay attention to those because there are going to be a lot of household incomes that are gigantic, and you really kind of don't want to put those in there because not everybody makes a gigantic salary. So it's really good to listen to when people are talking about the average household income versus the median household income.
A median would be closer to what more people experience rather than a mean or an average.
Right, which is why we like to give the median age when we are giving you point in time numbers when we're reporting that back to you, because it's a little more, it's more accurate than your average.
Did you get out there too?
I don't think so. No, I did not. Okay, so let's go back to number 2. Thanks for the questions and for the math again. Sometimes you just got to go back to the simple stuff. Okay, so measure 2. I think I mentioned that we look at 1, 2, 3, 4 different ways or time periods for people who have returned to homelessness once they have exited to a permanent housing destination. And here we like to see people exit and obviously not return. So we want to see reductions in the percentages from year to year. And even though a person has exited to, you'll see, exited, exit was from a PH, which is a permanent housing destination, we have to assume that those people who are back in the system, that they actually did end up becoming homeless again, because in order for them to get in the system and qualify for a program, they actually have to be homeless. So that is measure 2. Measure 3 is just the number of homeless people, and I'm sorry, I probably should have said this at the beginning. These system performance measures look at everyone using HMIS, regardless of funding source. So if you're not funded, you don't have any federal funding, anything like that, and you're using HMIS, you are still part of this. So you're definitely still accountable to the COC for the numbers here. So for this, you're going to see up there at the top, changes in point-in-time counts. Now, we count people in two ways here. The first one is the point in time. We call it PIT, point in time. It's coming up, like I said, January 26th. And this tells us how many people are homeless on a single day, just one day. And then if I can just move down just a little bit here, we will see annual counts. Now, this is the second way that we count people. And the annual count tells us how many people are homeless over the course of a year. So not just that one night in January, but through the course of the year. So those are the 2 different ways that we count people, and that is measure 3. Measure 4 is actually only for COC projects. Now, I say that means when we turn these numbers into HUD, we only give them the COC project numbers. But here's the deal. Even if you're not a COC funded project and you're using HMIS, you can still, and I highly encourage you, you can still run these numbers on your own. I really would encourage you to do that. So what this is, I've got it broken up here. So the first one we are doing are stayers. Okay, so what we want to do, these are people who stayed in the system during the reporting period that I mentioned. We look at employment income and other sources of cash income, and we know that when a person's income increases, then they are more likely to be able to retain their housing. So what we want to do is we are looking at the head of household income here, and so it's employment income versus non-employment cash income. So the first one you'll see is increased earned income, and then 4.2 is increased non-employment cash income, and then if you just scroll down just a scotch there, you're going to see total altogether. So see those percentages there? We want those higher, really, really higher. So if we go to the next slide, then we're going to take a look at the levers. And again, that first one is increased earned income. And then the second one is increased non-employment cash income. And then that last one is the total. And some of those people will, obviously overlap there, where they've had increase in earned income as well as non-employment cash income, but that number has to be higher. Mainly, and we know that this number is higher. What this is we really need our case managers to show, their job. I mean, you all are doing your job. Sometimes it just gets, we understand it gets hard to enter this stuff into HMIS, but we really need this so we can show what a good job everyone here is doing and what we're doing for the clients as well. So that's measure 4, and we will move on to measure 5, and this one is homeless for the first time. And this one gets a little tricky just because of how the system likes to, the time period that the system likes to pull. So what we want to do obviously here is reduce the number of people who become homeless in the first place. And here's what the first time means. First time homeless for the system means that a person has not been served by the community's homeless system in 2 years prior to entering the system. So this goes 2 years back. And again, we chop this up like we did some of the other ones. The first one, 5.1, looks at emergency shelter. We don't have safe haven in transitional enrollments. And then the next one, 5.2, same thing, emergency shelter, transitional, and then we do permanent housing projects as well. So again, obviously what we want to do here is reduce, reduce, reduce. We want to reduce all of these numbers, obviously, except for income. Everybody wants an increase in income. Okay, that's measure 5. Measure 6 does not apply to us, so you won't see it. So we're going right on to measure 7. Craig just had a heart attack. He's right on the slide. Okay, so here this is successful placement from street outreach and successful placement in or retention of permanent housing. It's a mouthful, I know. This one is really fundamental to our homeless assistant project. So we want to move people from homelessness to permanent supportive housing. So the first one, the first part here, focuses on housing and other destinations for people served in street outreach projects. And then the second one focuses on housing placement and retention for people in various sheltered or housed situations within the system. So we're looking at the exits from street outreach and then the changes in exits to permanent housing destination and then the retention of that permanent housing. So these are our system performance measures. These are not bad right here. These are not bad at all. Cameron's going to really talk to you about the impact on the COC, but if you need assistance and you want to look at this on your own and for your community or just your agency, I'm more than happy to help you with that. And this is still new to us, so there are still things that we are learning and still things, you know, that are going to pop up where we're going to say, oh, okay, well, that makes more sense now. So bear with us, but it's really exciting, it's really interesting, and this is such a good way to measure our performance, which, oddly enough, it's called system performance measures. So I would encourage you to do real-time data, again, with your HMIS, real-time entry, put it in there, and get that stuff to us. So Cameron is up next, and she's going to talk about the COC plan and the impact of the system performance measures.
So with system performance measures, no, and I'm going to shoot it to Caitlin for a minute. I just want you all to know, so this year, at least what we've been told by many, many people, is that, again, just like with the PIT this year being a baseline for the youth count for communities, this year is the baseline for COC and system-wide performance measures. So we don't anticipate this is going to be scored, possibly not at all, and if so, very little point value on our COC application. However, we do know that this is how we are going to be scored, and it's going to be a significant portion of our scoring moving forward with the HUD COC program. And again, we're not just looking at our funded projects. This applies to everyone using our HMIS system. That is any one of those project types. As you all know, we're big. We're a lot larger than most COCs, so we're not just looking at one county. We're working on splitting up SPMs, at least for you all to look at as LHCs and to start reviewing data of your projects together. We also really encourage individual projects to start pulling these, just like you're pulling your other reports on a quarterly basis and reviewing them, right? this is how we're working as a system. And as Lindsay said, our numbers, they don't look that bad. You know, the income is concerning, and we, you know, are working to determine whether that is just a lack of, like, a data entry issue, or it's just not happening in our projects.
Are part of the system-wide performance measures, are they looking at holes in the data as well?
No, but we can figure out what the holes are. What after we
Jesus
pull
is
them.
really good at
Yeah.
figuring out where the holes are, and it's usually around 1 o'clock in the morning.
So, for instance, like with income, if you, and we were talking to some agencies about this just last week, if you don't enter a client's income when you enroll them into a program, if they get increased income, we're never going to know because we don't have anything to show there was an increase, right? And it also, you have to enter that information within a certain period of time after the client exits, or it doesn't pull in the report. So it gets complicated, and I think, again, just want to say how important your data is to the work you all are doing and the work that everyone across these 215 counties are doing. We know that, you know, it's a challenge. Our service area is a challenge for us and for you all, we know, and and I'm going to actually talk a little bit more about that later, but just want to continue to stress that you all, while very far apart in many cases, are part of a team and a community that is trying to end homelessness in a large portion of the state. And all of the work you do, all of the hard work you are doing is impacting other projects across the state. And that's what we're dealing with in the balance of state now. So just, we want to work with you all on this. Again, y'all are going to get tired of us sending you reports, but we really want to stress the importance of the data, and we're going to continue to do that. And please let us know how we can support you.
So we had a question regarding entering income. What happens if they just keep changing jobs and their income goes up and down constantly?
We still want to track that. And that may mean, and that's a great question. Great questions, Alice. That may mean, you know, yeah, that may not look like a good outcome, but potentially if a client goes out with more than they came in with, it's positive.
And
right?
That, you know, moving from job to job and fluctuating incomes, that's all part of the client's story.
Yep.
And that's what we're trying to do, is capture the client's story.
Yes. Thank you, Lindsay. So, yeah, data. Please run these reports, review them. If you're not sure how to do either of those things, get in contact with our HMIS team. As I said, we're kind of working on a plan now for coalitions and communities, so you all can review these as a group and work together on increasing these goals and getting folks into housing and ensuring that they're going to be able to maintain that housing. And that was longer than I thought it would be. I'm sorry. Thank you, Lindsay. And
thank you, Caitlin, for being a good teacher. I am not.
I just wish I would better at math.
Yes. I mean, we're really good at cat pictures around here, but sometimes you can't ask us simple questions.
Also, and I failed to mention this earlier, and y'all have been good about it, but please, we do have time for Q&A at the end of the meeting, but always jump in. If we can't answer a question right away, we'll answer it at the end of the meeting, and if we can't do that, we'll get back to you. You know, it is our preference to be sitting at a table with each of you wherever you are, and that's just not the reality of the work we're doing. So please always ask questions and engage with us, and if you think of something after the meeting, get in touch.
That's what we're here for.
Caitlin is going to talk with you all about ending veteran homelessness.
All right, and I promise I will make it fast. So I wanted to update you guys on a really exciting tool that we just filled out with our supportive services for veteran families grantees. You might hear them referred to as SSVF, and that is the Supportive Services for Veteran Families Grant. It's provided through the VA, and it provides rapid rehousing and homelessness prevention services. In addition to that, they have this really awesome, robust community planning process that they participate in through the VA. And one of the things that they do is they have to complete a gaps analysis. So this takes their local data, all the data that we can somehow mine through HMIS, and it helps us determine if we have enough rapid rehousing specifically for veterans throughout the balance of state. I will say there are some severe data challenges around completing this tool with a degree of accuracy, but it's always a really great thing to see how much progress that we're making and seeing all of our SSVF grantees work together. So it was a really great experience. It got submitted on time. It's currently showing that we have excess rapid rehousing placements in the balance of state. Although, as I mentioned, data issues don't really lend itself well to using this tool for planning for our purposes, because gaps in one area might get obscured by extra placements in other areas. So maybe we have a gap in Abilene of 25 places, but then the areas around Houston have 50 extra placements, and it kind of looks like we have a gap of 25, but we don't know where, and we're not going to move folks from Abilene to Houston just because that's where the rapid rehousing is, because that might not be the client's preference. So it always gets a little confusing trying to fill this tool out, but like I said, it was a great chance for us to get in touch with all of our SSVF grantees. I also wanted to point out, for those of you who are tuning in with us from Lubbock, that the SSVF program up there that is partnered through StarCare, they're called VetStar, just added 10 counties to their coverage area up in the Panhandle, so woo, go StarCare. And we're really excited to help them expand their coverage area up there so that way they can serve even more veterans in more places. The next time some of you SSVFers who are on the call might hear from me is I am working to get some data issues resolved in HMIS. Some of y'all enter into our HMIS system, some of y'all enter into different COC's HMIS systems, and we're going to try and make sure that the data that needs to go to other COCs can get there, and that data that needs to stay here can come here, so that way our reports are nice and clean and pretty for the end of the year. And that is my update.
Thanks, Caitlin. If you can pull up that work plan draft. There we go. Y'all, this is Cameron again, and this is going to be brief and is an outline. So as such, we're working on our strategic work plan for the year, and are going to be getting feedback from you all, and our board, of course, will play an integral role in developing this. I don't know if I should say this or not, but I think this is the first work plan the balance of state has had.
Official work.
Official work plan, of course. People have been working very hard for years. But we want to, we're working with you all on performance measures and outcomes, and we want to, walk that walk. So working on our work plan, and I just wanted to go through our real baseline goals and objectives just to kind of let y'all know where we are, and those are the 8 we have listed here. That's increasing engagement, collaboration, leadership, strategy, and strategy implementation on the COC. That is going to be a lot of work with our local homeless coalitions. It's also going to be you all seeing us out in the field a lot more this year, and that's also due to additional funding we got on one grant. And we, as you all have heard me say, and folks we've visited lately have said, and we know there is no substitute for face-to-face visits from us. We know that, and that is our hope, to get out and see all of you and work with all of your communities. And it's there are so many of us here. Well, I guess few compared to the many of you out there. But I do want to let you all know we're definitely beefing up our travel this year, and especially with CE implementation. You're going to be seeing us in your communities. Number 2 is obviously improve access to stability and safe, affordable housing. developing integrated coordinated entry system and housing crisis response system. You heard from Sophia about some materials that we are going to be putting out. Please comment on the standards. You know, I'm not going to get too much into CE, but we feel like the work that's been done here, what we've learned from other communities, what some of us have learned from our work in other COCs, is all going to be kind of, like Soph said, you know, put together in a really nice package for you all, because the reality is, and it's been figured out over the past few years, we're not going to get to every community to be able to hands-on help you implement CE. We want to be able to give you all of the tools and as much support as we can, and a visit when we can, but we just do not have the capacity to be in every community to get this done. Number 4, expand economic development opportunities and strengthen individual financial stability. That, you know, we just talked about income, and you'll see us integrate the system-wide performance measures into all of these larger goals and objectives. Really want to look at how to integrate primary and behavioral health care with homeless assistance programs and housing. You all know, probably have heard us and others say housing is healthcare. Also are thankful to have our new, well, our former board as well, but we've got a lot more diversity and feel like we're going to be able to have a much bigger impact in some of these areas this year. 6, you've heard it a lot today, improving our HMIS system and any other data collection and reporting to drive policy recommendations, and also to inform program design and maintain and increase funding. We're going to work on building our existing capacity and improving performance. That's for us, you know, as a COC, and you all as LHCs and organizations, and then ensuring a COC governance structure and planning that enables strategy implementation and meets the requirements in 24 CFR Part 578. Again, that's the interim rule and HUD talk. I know that was a quick mouthful. Just kind of wanted to let you all know that we are working on this. We will be getting it out soon, and we're really going to break these down into smaller, kind of measurable, really clear goals that we're going to be working with you all on. And again, they're going to be based on opening doors and system-wide performance measures. So also wanted to let you all know some exciting news, or we think it's exciting news. We are getting ready to start a technical assistance contract with the Corporation for Supportive Housing, CSH. This is TA that we are getting through HUD as a priority community. HUD identified some priority communities about 2 years ago based on homeless population, and no surprise we were one of those. And the unique thing about this TA is that we have been communicating a lot with HUD, a lot more with HUD since the Tier 2 cuts in the spring and, well, I guess summer, right? And in the opportunities that we've had face-to-face and online, really working with them to figure out the best way to tackle this beast that is the balance of state, and to give you all, you know, the best support that we can, and also to not have to figure out ways to clone ourselves. So HUD is kind of, it's sounding like this TA that we're getting is in some senses like a pilot program. Normally these are really very kind of rigid and prescribed plans for COCs, and for us, because of kind of our unique geography and situation, we're getting a lot of flexibility from HUD and CSH, and we're really, really hopeful about where this work may lead us. I think you all have heard us talk about things like splitting up into regions in the past, and just how we can better structure the work that we do. And we're excited to get some help with this. CSH looks like they're going to be coming down in December to spend about a week with us to really understand what we do, probably coming out on some site visits to meet some of you, to start understanding the differences between a large balance of state like us versus a 1, 3, 6, 10, I don't know, 50 county COC. So it's something we're really looking forward to. We will keep you all updated on that as it happens. Again, right now we're still waiting to execute those contracts, and that I have another, again, exciting announcement for us. We are finalizing a TA contract with Org Code. Some of you are probably familiar with Org Code. Ian DeYoung is their president and CEO. He's the designer of the VI SPDAT, which is our coordinated entry tool. And some of you may have also gotten to see a session with Zach Brown at our conference. We're going to be working with them to bring some workshops across the balance of state to talk about lowering barriers and creating amazing emergency shelters and how to do rapid rehousing and housing first and best practices. And we're really excited about these. It's probably going to be 2-day workshops. We're also going to develop some webinar and online content for those of you that can't make those. And we haven't decided on locations yet. We're not there. I think it'll probably be similar to our Provider Connect workshops we did last year, except the big difference is that these are not going to be just for COC or ESG funded projects. These are going to be for everybody in your community, and we're really looking forward to that. And that just reminded me, can you send him that link for their training? Yeah. They've also, Org Code has a bunch of learning clinics coming up. I know some are going to be in Dallas, and again, know that we're going to be doing some of this with them, but maybe a little different. I don't think you can, or I can't get too much Org Code. I can only speak for myself, but Craig will pop up a link letting you guys know about some other trainings that they have coming up. And I'm going to just move on to travel. Just kind of wanted to update you all on kind of where we've been and what we're doing outside of the office. In the past month and a half, the list that you see in front of you, I know there was travel to Bastrop, which isn't far, but still travel for us. And again, you know, any on-site and face-to-face visit is something we really enjoy and value with you all. But there was Bastrop LHC meeting and PIT training that Mary and Lindsay did. Eric and I had a trip to Laredo to go to a meeting with Congressman Cuellar, Mayor Sines, all the LHC there, and all of the providers. Had a really good discussion around data and systems change and ending veteran homelessness. And we are anxiously awaiting contact from the mayor in Laredo to start working on this task force to end veteran homelessness there. We also Sophia and I just returned from Denton. Last week we were able to attend a coordinated entry transition team meeting, several new providers. Jesus and Victoria did an HMIS training. Sophia and I also attended their Homeless Summit, and just really, again, can't beat that face-to-face time. Impressed with the things going on in all of these communities and really see them kind of stretching and growing and having conversations about data and best practices and housing first. And it's exciting. And we know it's a shift for a lot of places, but we see you all making progress and want to support you all in any way we can. Mary right now, like I said today, was joining us from Paris. She's not France. She's also going this week to Mount Pleasant, Sherman, Athens, doing some LHC work, meeting folks out there, providers. New coalition is kind of getting off the ground in Sherman and are having a fundraiser for their pit. I'm going to be in Corpus next week presenting to the Advisory Council on the Homeless on Housing First, and hopefully meeting with their mayor. And Mary and Lindsay are heading out to Galveston the beginning of December to go to one of their coalition meetings and also do some PIT training. So, like I said, we're getting out there. You know, we can't get everywhere, but if you're interested in a visit, let us know what you're working on. We may ask you to do some work before we come out, but we're excited to be able to get back on the road and really get on the ground with you all and see and hear the work that you're doing. And while I'm talking about that, I just also want to stress to you all, again, I know we're big and busy, but we spend a lot of time researching and understanding best practices, and not just for our funded projects. Really, please reach out to us if you're considering starting a new program or opening a shelter or, starting an LHC, anything in your community that's going on like that. We are happy to support you on that. We're happy to review eligibility and give you feedback on program design, and ask you, how you came to this decision as a community and talk about your data needs. We're here and we want to hear from you. So please know, there's an open invitation. And that's a lot of me talking. I'm going to hand it off to Caitlin and Sophia for a policy update. And, after hearing from Sergeant Quijada, I think our criminalization on the homeless is kind of right on time. So Caitlin.
Sure. So hey y'all, this is Caitlin again. I want to present to you a policy that the Texas Balance of States COC Board just passed. Every year on the COC application, we get asked about the criminalization of homelessness in our COC and if our COC has any policy prohibiting the criminalization of homelessness and what work we do to prevent the criminalization of homelessness within the communities in which we work. And every year up until now, we've kind of been like, because, we don't have a uniform policy, or we hadn't had a uniform policy up until this time, so it was sort of addressed in a very piecemeal fashion across the balance of state, and we wanted to do one better than that. So there are many different reasons why the criminalization of homelessness is not an effective way to approach ending homelessness. We've outlined that here in the criteria. Among some of the reasons are that it doesn't actually address the problem. It kind of turns into a revolving door. It makes it harder for people experiencing homelessness to get into housing. As many of you know who have ever tried to house a homeless individual or family, if you have a criminal history, it's a little harder to get past those pesky apartment background checks. And it's also very costly for cities to continue to utilize their criminal justice system as a way to address homelessness. And it's just easier, it is more humane, and it is less expensive to just put someone in housing and provide them with appropriate services. So Craig, yeah, we'll stop right there. We propose that the folks in the balance of state support the decriminalization of homelessness in three main ways. One, they'll try to abolish criminalization of homeless laws and policy at the state and local levels. So if you have a city council that's considering a no-sit, no-lie ordinance, consider maybe advocating against that or speaking at your city council meetings. We want to make sure that we're ensuring close cooperation between all relevant stakeholders, including social services, health services, law enforcement, justice professionals, which is something that we do already on the COC levels. We try to make sure we include all stakeholders in on making decisions as it affects people experiencing homelessness. And last, we can help assist in developing incentives to decriminalize homelessness. So that might look very different on the local level. So then we scroll down to what our actual policy is, so what we've actually adopted and committed to doing, is that agencies and programs within the Texas Balance of State COC, so that includes any and every program that is within our geographic area, not just those that are ESG funded or CFC funded, each and every project that is working to end homelessness in our geographic area will not participate in or support any activity that may directly or indirectly support the criminalization of homelessness. And this has already been approved by our COC board. I'm going to pause to see if we have questions about it.
Haven't seen any yet.
All right. Well, I'm going to leave it there. This will become part of our COC policies and procedures. It is not currently in the iteration that is on our website, but it will be soon. I wanted to present it to you guys first.
You ready?
Yeah, sorry. Whoa. Hey, so y'all, Caitlin and I attended a training yesterday?
Yesterday.
Yeah, gosh, it feels like 4 years ago. So Caitlin and I attended a training yesterday on HUD's new equal access to housing final rule. So a little bit about this. In 2012, they released a final rule entitled Equal Access to Housing and HUD Programs Regardless of Sexual Orientation or Gender Identity. And what they found, there was a study that was conducted. I actually sent Craig a bunch of links to send to you guys. There was a study conducted through the data, but also through comments that HUD has received, they had found that there were a lot of holes that needed to get filled. And so recently, the new rule was released. And it is titled Equal Access in Accordance with an Individual's Gender Identity in Community Planning and Development Programs. Essentially what this means is you cannot discriminate against people based on their gender identity, and it also means that you must provide reasonable accommodations for people. I'm going to leave that there real quick. We highly recommend that you attend the trainings if at all possible. I do believe HUD said that the ones that they have currently scheduled are full. However, they are planning on doing additional ones because there is a lot of interest. It was an excellent webinar. It was the first HUD webinar in a long time that I didn't feel like I needed to bash my head against the wall because it was so boring. It was very interesting. It was very informative. It provided Gender Identity 101, and then they talked about what this rule means in the programmatic sense. So they didn't go into the minutia of the rule, which was nice. They talked about what is the impact on an emergency shelter, and what are ways that emergency shelters currently show discriminatory practices. It also talked about transitional housing and permanent housing projects. So it's really wonderful. They have a lot of resources released, and I think basically the message that Caitlin and I got from it is treat people as they want to be treated and treat them as you would like to be treated. So, yeah, do you have anything else to add?
Well, because we are running short on time, I'm going to go no. But if more trainings are released, we will make sure that goes out in an email so you can sign up. Or if the recording of the webinar is released, we will make sure that you guys get copies of that. This is a topic that can get very emotional for some people, and I thought HUD handled it extremely well and really addressed a lot of people's concerns and fears. So I would 100% recommend watching it as soon as it becomes available, and we'll let you know as soon as that is.
Thank you. So y'all know, yeah, we sent out an announcement about this to grantees, and COC and ESG projects, your policies must be consistent with this new rule, and you can get dinged by HUD if you are in violation of it. So if you haven't signed up and didn't attend the training, please do so. I would encourage everyone, regardless of funding, to do this. And again, we'll post the materials as they become available. And we're getting close to time. I think quickly, I would be remiss not to mention or acknowledge some concerns about future funding for the work that we all do, especially that is funded by the federal government and potentially the state. So just wanted to, and this is something you all on the call know, you know, in the wake of this presidential election, like any other election, there's going to be a pretty large administrative change and policy shift that will most certainly impact budgets. And, you know, we can't predict the future, and we don't know who will be appointed as Secretary of HUD, but just do want everyone to be aware that some lawmakers are pushing for short-term stopgap funding measures, or a continuing resolution, also known as a CR, to delay funding decisions until our president-elect is sworn in. And we don't know yet what his preference is going to be, if he's going to want to pass a CR or a full year of spending bills. But if Congress doesn't approve a full year for fiscal year 2017 for HUD as soon as possible and they pass a CR, we could see a really steep shortfall in funding for our HUD program. So just want to remind everyone, let's stay united in the work that we do and stay informed. And if you are concerned about cuts to critical housing programs, to get in contact with your politicians.
Call me today.
We're at 4 minutes, and I know it's not a lot of time, but I wanted to see if anyone had questions. I see we actually have some here. Jesse, we've got a question asking if criminalization of the homeless includes panhandling bans.
Sure does.
It does. It does indeed. Jack Wheeler. Y'all crack me up. Thank you for bringing humor. Scandalous.
Did you put the housing not handcuffs report up? So Jesse, just going to the criminalization, there's a new initiative through the National Law Center on Homelessness and Poverty called Housing Not Handcuffs, and they just released their report today that details what exactly it means to criminalize homelessness. So they go in depth into each law.
I feel it can even touch things like health codes where like sort of public feeding programs and things like that. So it's not necessarily being homeless is illegal. It's any ordinance that might make someone who is living outside be put in jail.
Yeah, and I think, and we have 2 minutes, so we can't get into it. Aggressive panhandling is a different thing entirely. And Michelle Yates, just an update. Oh, training for a coalition. Harlingen police are doing outreach. That's fantastic, and helping with their point in time.
Yeah, Michelle.
And Kim asked, please repeat where that information is found, but I'm not sure what that information is anymore because we've covered a couple of things.
I'm assuming it says working right now.
Kim, are you talking about the equal access and gender identity training? And just another really good reason to sign up for HD.
HUD exchange.
Thank you. Like HDX, I've been looking at AR stuff. A good reminder to sign up for the HUD exchange.
Oh, she wanted information on the criminal justice stuff.
I actually sent it to Craig, I believe.
I opened those
right?
for you just a second.
Oh, that's a different one. We'll get it to you.
Yeah, Kim, we'll send it out with the meeting materials. Anybody else have any questions? Sorry, y'all. I mean, I know we have 2 hours allotted, and we're happy when we can fill it, but we did want to save more time for questions. Yeah. Please remember, again, and didn't have a lot of time for them today, please feel free to reach out to us if you have questions, comments, concerns. We will answer them, and we will also share them at our next meeting so that everyone else can hear the answers as well. I guess, it's 4 o'clock, so I'm going to call it. Thank you all so much for your time. Thank you for the work that you do. Keep fighting the good fight. We are incredibly thankful for all of you, and if we don't see or talk to you, have a nice holiday.
Thank you.
Bye.
Thank you.
Don't forget we're in the AHAR zone.